Hello, my name is Miller Killgore and I'm your student occupational therapist. Today we're going to be talking about your medications you've recently been prescribed and their precautions and side effects that they will have on you, as well as an intervention plan to manage your medications. Because you are a business manager, it is important for you to understand the importance of your medication management and organization so that you can continue to be a successful business owner. Does this sound like something you're interested in? Perfect. So we'll just start by going over your two medications that you've been prescribed, which are Risperdal and Geodon. The Risperdal has a few side effects such as fatigue, increased appetite, urinary incontinence, anxiety, tremors, and rash. There are precautions of using Risperdal specifically. You should be aware that you have an increased risk of seizures. You might have thoughts of suicide. You're at a greater risk for strokes and orthostatic hypotension, so low blood pressure when you're standing out of a chair or just out of a seated position or when you're lying down, and also dysphagia. Your second medication that you're taking is Geodon, and the side effects for that medication are also fatigue and dizziness. You might have a little restlessness, constipation, rash, abnormal muscle movements, and tremors with that medication as well. And the precautions for that are that you should be aware that you have an increased risk of disrupted heart rhythm, neuroleptic malignant syndrome, and just to let you know that if you do start seeing symptoms of any of these abnormalities with this medicine, a doctor should be notified, and the patient should seek medical attention immediately. You should also know that a doctor should be notified if you are pregnant or consider becoming pregnant. So, and if you have any questions about anything, just let me know. So we'll move on to the intervention plan now. So I've put together an intervention plan for you to be able to manage your medications, for you to be able to keep going to work and be a successful manager of your business. So I thought it would be useful to you to put Post-it notes on your bathroom mirror when you get up in the morning to remind you to take the correct dosages of your morning medications. These can also be motivational quotes that improve your quality of living. So just know that they are a reminder to take your medication, but it's also there for your encouragement to know that you will be stable with these medications. Also, a phone alarm can be set for the afternoon and evening medication times and dosages that you should be taking. Also, I thought that it would be efficient for you to get a daily planner to keep track of your medication that needs to be taken during certain times of the day, weekly, daily, hourly. And when you have taken this medication, you should put a little check mark by it to notify yourself that you've already taken that medication for the day. You can continue with your daily activities. This is also a good technique that you can use to feel accomplished throughout the day and organized as well. Just a suggestion, you could get a planner that could fit in your purse or your pocket. This is a good idea for if you're at work and having to take medications or you go on vacation. There's also another suggestion, a weekly pill container that divides your pills by which days you're supposed to take them. So you could keep that with you. That's easy to bring with you. And it's important for you to have the medication management to improve your quality of life and so that you can continue your day just as normally as anyone else would. And these medications need to be consumed appropriately and effectively. So with that being said, um, things always come up and sometimes we forget. But in the case of an emergency, such as a natural disaster, we can have an already packed bag, and this can have your emergency supplies can be added in with this. So I advise you to pack a bag that has a week's worth of medication packed with your other belongings, and this will ensure that if something does come up, then all you have to do is just grab that bag and you're ready to go. Um, I will remind you to check the expiration date on your medications to ensure complete safety of the medications you are taking if something like this happens. If my intervention plan doesn't work for you, there's an alternative option. You could have a family member or a guardian or just even a friend call you, make daily calls or texts to remind you to take your medication. With that being said, with the daily calls and texts from a family member or a friend, these could also be motivational quotes for you to be encouraged to want to become better and for you to live a healthier and better lifestyle, for you to live the most normal life that you possibly can. So if you have any questions about anything, please reach out and I am happy to help. Thanks so much and have a great day.